The first batch of the Pfizer COVID-19 vaccines has arrived in South Africa. It's as pressure, of course, continues to mount on the government to begin vaccinating the general public before a potential third wave hits us. Well, to give us an update on the rollout and perhaps his own views of where we are, we're joined by Wits University Vaccinology Professor Shabir Madhi. Professor Madhi, good evening to you, and thank you so much for your time tonight. Before we get into the details of the vaccine, I want to maybe just begin with these confirmations of a report of somebody who traveled from India testing positive for COVID-19, and big questions about whether or not we now are running a risk of having the variant that was first discovered in India circulate in South Africa. I mean, it's all really very new news right now, but I wonder, how closely are you watching that?
So good evening, and thank you for having me. So I think the reality is that there possibly are imported cases of the variant that first emerged in India into South Africa, and this hasn't been confirmed as yet. As you're probably aware, the cases that have been identified of travelers from India is currently being sequenced to see if it is a variant that circulates in India. But that being said, I think we also need to appreciate that irrespective of whether this variant is imported from India or not, there's a high likelihood that the virus will continue undergoing mutations even in South Africa. And essentially what's happening with these variants across the globe is that there seems to be convergence in the types of mutations that are occurring, and much of that is driven because of the virus being exposed to the natural immune responses that has been induced by past infection. So even if we don't have the imported case immediately of the variant that's currently dominating in India, it doesn't mean a similar variant won't evolve in South Africa in itself.
Of course, something like this is likely to cause a different kind of panic among South Africans. Is the answer in the scenario to shut down the country's borders, or are we simply delaying the inevitable if we do that?
Yeah, unfortunately, it's more a situation of delaying the inevitable if you allow the virus to continue transmitting in a country. And it's extremely difficult and probably impossible right now for us to stop the circulation of the virus in South Africa. So it's really delaying what probably is inevitable. And as I mentioned, there is convergence of the types of mutations that are occurring globally, resulting in a virus being one which is able to more effectively evade immune responses that's been induced by past infection. So there's no getting away from it. What we can do is delay it by limiting travel from India or asking people to go into quarantine. But I don't think that itself is a solution, unfortunately.
When you look at where we are right now, of course, we're still registering relatively low numbers in terms of the rate of infection. Your own projections about what we need to do in order to stay where we are. And of course, Shabir Madhi, we almost kind of want to hold things off as they are and pray that it just doesn't get worse or even repeat some of the scenarios that we as a country have been through, whether it was in, the first peak or the second peak of the virus.
Yes, unfortunately, already in the Northern Cape, in Northwest and the Free State, we're seeing significant increase in transmission of the virus and the number of cases that have been documented. And as you're also aware, what we refer to as a positivity rate, the percentage of people that test positive, that has kept above 5%, which unfortunately is a bad sign. The reality is that there isn't much we can do in the absence of having already rolled out a COVID-19 vaccine program to prevent the next resurgence from occurring. The big question is, what's the magnitude of the next resurgence rather than whether one will occur? And what the magnitude of the next resurgence would be might actually differ across provinces. To a large extent, it's also going to be determined to the extent to which the virus continues mutating. So if the virus remains fairly stable, and considering that a high percentage of South Africans have probably already been infected over the course of the first two waves, then the third wave might be relatively subdued. But in the event that the virus undergoes further mutations and evades the immune responses that's been induced by past infection, then we might experience as bad a situation as the last wave. So there's a number of factors, unfortunately, at play. And what we need to do to try to draw it out is continue wearing the face mask in public spaces, and especially in indoor spaces. and to assure that we actually got adequate ventilation when indoors. Those two are probably the most effective tools that we've got in our hands that is able to somehow manage the spread of the virus.
Let's talk about the vaccine rollout. We are expecting that there will be at least the real rollout of the vaccine beginning sometime before the end of May, if all things go according to what government has been telling us. Do you see the arrival of the Pfizer vaccine as a positive step, although the number of vaccines that have arrived are still quite, those numbers are still quite minor compared to what we actually need at the end of the day?
Absolutely. I think the arrival of any vaccine that has got potential to protect against severe disease is most welcome. Obviously, the larger number of quantities, the better. The concern with the Pfizer vaccine right now, as you mentioned, is that we're looking at getting about 320,000 doses per week, if I'm not mistaken. The government target in terms of what it's wanting to accomplish in phase 2 requires us to vaccinate close to 150,000 new individuals each day in the first month, and that needs to go up to 300,000 per day by month 2 when people start become eligible for a second dose. So the number of doses that are coming into the country, unfortunately, is fairly limited, and we need to be wise in terms of how we plan to optimize the use of those doses to ensure that we can get some measurable protection before we peak with this third wave.
Are you concerned about this testing that is currently being done on the Johnson & Johnson vaccine, in particular with that one contractor that was responsible for part of the mixing of the ingredients that were told?
Well, it's concerning insofar as, I think the important thing is that we should welcome that it was identified and it's being investigated. But obviously it's concerning in relation to the limitations that will be experienced when it comes to accessing the Johnson & Johnson vaccine. So any delay of introduction of any vaccine is concerning, and more so in a country such as South Africa, where we've got very limited options in terms of which vaccines we've procured, which is only the Johnson & Johnson and the Pfizer vaccine. So it's not going to be very helpful in terms of the rollout of the vaccine, and from that perspective, it certainly is concerning.
Professor Madhi, I know that you also did some work, of course, on the Novavax vaccine in this part of the country. Up to date, has there been any conversation about government procurement of the Novavax vaccine? And if not, are you surprised by that?
Well, if there hasn't been an update and a rethink of not wanting to use a Novavax vaccine, then that would be hugely disappointing. This is a vaccine that has got 100% protection against severe disease due to the B.1.351 variant. Very few other vaccines can actually claim to have that magnitude of protection against the B.1.351 variant. I can't sort of speak on behalf of government as to whether it's revisited its position, but it would be highly unfortunate if we close the door on the Novavax vaccine, one of the vaccines, in my biased opinion perhaps, that shows the greatest prospects of being able to limit severe disease due to the B.1.351 variant.
Have there been any attempts by yourself or any of your colleagues to try and begin that conversation again? Because the last time we actually got an update on Novavax was when you were releasing the results of that trial and just what you were able to discover.
Well, I think Novavax has engaged with the Ministerial Advisory Committee and it presented the latest data to the Ministerial Advisory Committee. So I think someone from the Ministerial Advisory Committee will probably be better placed to indicate what their thinking is around the Novavax vaccine. There are some issues with regard to the efficacy of the vaccine in people living with HIV. But at the same time, we don't know any of the other vaccines, including the Pfizer vaccine or the Johnson & Johnson vaccine, would work in people with HIV. So there are concerns for all of the COVID-19 vaccines when it comes to HIV-infected individuals. But as to whether the government is reconsidering its position on the Novavax vaccine, unfortunately, I'm unable to pronounce on that.
So part of what I'm also trying to really understand, Professor Madhi, is that given these limited options that we have where vaccine supply is concerned, are we truly making the most of the alternative opportunities that could perhaps exist within the same ecosystem? Because ultimately, given the kind of questions that we have on all the vaccines and how some might respond to the local variants in particular, the idea of preventing people from getting severely ill or even from dying from COVID-19, that seems to me that should be priority right now.
Absolutely. Right now, the whole notion that South Africa can get to herd immunity by vaccinating even 80% of the population is very misgiven. That's not going to happen in the South African context. In fact, even a country such as the United States is reconsidering its position as to whether the United States will ever get to herd immunity. It's all about protection and protecting high-risk individuals from developing severe disease. And there's many vaccines that are available that show strong prospects of protecting against severe disease, including the AstraZeneca vaccine, which we decided not to use. So we need to keep our options open in terms of getting as many vaccines from as many suppliers in the shortest period of time as is possible to make sure that we can protect people from dying and from being hospitalized due to severe COVID.
All right, let's leave it there for tonight. Shabir Madhi is a professor of vaccinology at the University of the Witwatersrand. Thank you so much for your time tonight on News at Prime.